Wikidontist.com. Truth about tooth.
Last video we spoke about what all has to be taken care during pregnancy to have a very good teeth, so that you will have a great smile. Today we are going to talk, even if you have not done really well during the pregnancy, you can still do some treatments during pregnancy. So please watch these videos to understand what all treatments can be done, what are the differences of treatment for the pregnant women and the other people. If you are watching it for the first time, please subscribe my channel, press that bell button so that you will get personalized messages as soon as I upload a newer video. I have been talking about different topics about dental treatments and dental care, even home care and things like that. So please look into my videos. Please watch them. Tell me if you have some suggestions. If you have some questions, you can ask me as comments. And today we are talking about treatments that can be done during the pregnancy. Is there any difference? Is there any contraindications and things like that? There is absolute contraindication when it comes to doing a large X-ray or doing some large procedures which involve a lot of antibiotics, because most of the time it needs a gynecological approval. The gynecologist has to approve and things like that. Hope there is no large infections which is happening, or if there is a cyst nucleation, we still have to do it. Otherwise, X-rays are not done during pregnancy. That is one thing which we don't do, and if at all it has to be done, it has to be highly protected and things like that. We still have equipment, and we have simple things that can be used for like a lead sheet cover and things like that can be done even during pregnancy. But we still avoid taking an X-ray and taking an X-ray even when a pregnant patient is on the other chair also. So we usually avoid X-rays during pregnancy. So can we do root canal treatment? Yes, we can still do root canal treatment and correct infections. If there is a large pain, then we still can use apex locators, wherein we can still find the tip of the root where it goes. Still look into removing of all the infections and debris inside the root, and then you can even fill the root. But you'll have to wait until you finish your pregnancy term, and then we'll take an X-ray and confirm whether we have done a great job, and then but still that will actually alleviate all your pain during the pregnancy, and still you will save the tooth also. You don't have to extract the tooth. Is it safe to extract the tooth? Yes, it is safe to extract the tooth, especially during the second trimester. But we always take a consent from the respective gynecologist, so that to understand whether there is any other complications which is there any blood pressure increase, if there is any calcium decrease and things like that, so that they will also understand, and they will also give us an idea on whether we can do an extraction. But extraction is not at all the best solution. We are not extraction people, because those people who take out tooth cannot be called as a great dentist. It is the people who actually save the tooth has to be called as dentists or dental doctors. So personally speaking, we have to save all the teeth. Now, can we do a filling? Yes, we can do the filling. Why is it not recommended in the first place? It was that we were using amalgam, which is actually a silver and a mercury based mixture, and this silver amalgam could actually give some problems to the kid or the baby which is growing inside the pregnant mother. So it is better not to use. We don't use any amalgam in the clinic at all, so we can still use a composite. So some people say, see, are you using a UV light? No, we don't use any UV light for curing any composite inside the clinic. So that was 40 years back that we used to use. Whatever light we are using is a high intensity blue light, which is absolutely safe for any pregnant or normal lady. So that is absolutely safe. It is not a laser which is used, so you don't have to worry about it. Some people think that it is laser. It is not laser. It is okay to use even diode lasers even in pregnant women, but it has to be limited to the oral cavity. So all these things can be done. Can we do a gum cleaning? Can we do a oral prophylaxis? Yes, we can do that. Most of the dental treatments are kept during the second trimester, that is between the 3rd month and the 6th month. That is what is recommended by most of the gynecologist, but we can still do treatments even from the first trimester to the end of the trimester, provided we don't take any x-rays, we don't give any antibiotics that is actually harmful for the baby and the mother. So all these things has to be taken care, but still we can do all the treatments as normal as we do for most of the people. But only thing is, there are extra care for the pregnant women. Don't worry about people who are saying that you cannot do that treatment, this treatment. Especially there are a lot of people saying that you cannot do orthodontic treatment during pregnancy, but that is also wrong, because we can still do orthodontic treatment during, if you are already pregnant during the, or you are getting pregnant during the orthodontic treatment, you can still continue the orthodontic treatment. There will not be any issues. You can still go on. There are some areas wherein the gynecologists say that if there is a large complication, they might object having wires in the mouth. At that time, we can actually remove it, and then we can go for a we can change the wires, and then we can still continue the treatment after the surgical procedure or anything. So unless there is some complications during the pregnancy or some issues, there is no reason why we should postpone any orthodontic treatment or dental treatment. We have to have a consultation with the gynecologist and ask for what his or her treatment regime, especially when it comes to antibiotics. We can give amoxicillin or penicillin most of the time in a pregnant woman, so we don't have girth for that. Even if you are having an infection, we have other techniques like using lasers, or you can actually clean up this thing using other techniques, like if in root canal treatment itself we can actually use antibiotic lavages and things like that, wherein we can actually clean the whole root canals with antibiotics, so that we don't have to use a oral or injectable antibiotics and things like that. There are a lot of techniques that can be used to make the safe pregnancy for the kid and the mother. So there is no reason why we cannot do treatments. You don't have to suffer from the first to the end of the, if at all you have a pain or anything, we can still treat it successfully. But only thing is, we'll have to confirm with x-rays at the end of the treatment, as soon as the baby comes out and you are happy. So let all these videos be shared with all your friends who are getting pregnant or having a problem of tooth during pregnancy. Please send it to them. If you like the video, please subscribe and press the bell button. Please make sure that you send it to all those people who are young, married young, or having some problems with the tooth during the pregnancy, or having a tooth problem during the marriage. You can actually send it to them, so that if they are planning for a kid, you can actually they can actually have a look at the video and plan it accordingly. Now please make sure that you tell me what all suggestions you have. If you have some queries, please make sure that you put it on comment, so that I can advise you personally on what all has to be done. Please send it to your friends. Please tell them to subscribe my channel also. Thank you very much. I am Dr. Thomas Nechupadam. I'll come with another topic soon. Please watch for that, and God bless you. Let you have if you are pregnant, let the baby be born, and you have a better smile with all your teeth, so that the baby is also happy. Let them be happy, and let God give you a great baby, joyful baby to you. Thank you very much.
Wikidonus.com